Well, hello, everyone. My name is Tiami Luckett, and I am a Black trans woman from Arkansas. I was diagnosed with HIV in September of 2012. By the time of July 2013, I began taking my antiretroviral medicine, and in April of 2013, I became undetectable. It sounded good at the time, and I didn't quite know what undetectable was. And when my doctor explained it, he was of the consensus that it greatly reduced the risk of transmitting HIV to a partner, but he wasn't so comfortable saying at the time that there was no chance or negligible risk, right? And so that was something that he and I always kind of butted heads on, because I just knew that I wasn't a danger to anyone. And actually, I was supposed to attend the International AIDS Conference in Durban, South Africa last year, where I would have heard the information for myself. But thankfully, Bruce came back from that conference and brought the information back and started this great campaign. And so it is my pleasure to introduce Bruce Richman, who is the Executive Director of the Prevention Access Campaign, and he is also the founder as well, and Undetectable equals Untransmittable, U equals U, more commonly known, and that is a global community committed to improving the lives of people living with HIV and ending the dual epidemics of HIV and HIV stigma by ensuring communications about people with HIV catch up with the science. And Bruce, take it away.
Okay, thanks. Tiami, can you hear me okay?
Yes, I can.
Okay, great, thanks. So just wanted to mention that the YouTube video that you just saw, you can find the whole video, because I think there's some technical problems, at u=u.org and spell out equals, or at preventionaccess.org. So it's really exciting to be here, very encouraged by the Federal Health Department's process of reviewing the messaging about the risk of transmission from a person living with HIV who's virally suppressed. We really appreciate this process, and thanks for including us. Next slide, please. So we're really proud of this slide because of our partners, International AIDS Society and AIDS-MAP. I think everybody knows who they are, and you can't get much higher in the field than these two wonderful organizations who have come on to endorse U=U clearly and unequivocally with these infographics. So we kind of start with this. Next slide, please. So we are at a defining moment, as Murray and Rich had said earlier, that 20 years ago we learned that effective treatment would save our lives, and now we know that also means that we cannot transmit sexually HIV to others. Next slide, please. Just click till you get to the bottom, please. Click through each one. Okay. So we already talked about that. Folks already talked about this. I think it's improving our lives. It's dismantling stigma, and that really should be enough. That should be enough of a reason to get this message and tell everybody. But I said earlier, it also improves treatment uptake and adherence, which means we'll be healthier and we'll have fewer transmissions. And this is the most effective strategy that we've ever had, an unprecedented opportunity to advocate for access, to universal access, because of not only the health benefits for us, but because the more people are virally suppressed, the closer we get to ending the epidemic itself. So we're hearing people that are actually making policy decisions based on this new science that they're learning. Next slide, please. Okay, so this is interesting. Now, I could spend an hour on this, so I'm trying to condense it. Why wasn't this getting out? There are many, many reasons, but the main reason why this wasn't getting out is that science, the aggregate of science, doesn't have a publicist. So there were the trees, lots of studies and interviews and statements, but no one was actually showing the forest. And many of us carry the stigma and fear around this epidemic for decades, and makes it difficult for us to accept this news. So what we were finding is that the studies were promoted independently by the researchers and the institutions that support them. So studies on the left, and they're all of the public health communications, whether it's communications agencies, AIDS and media outlets, clinics, ASOs, we would see time and time again that those communications were filtered through the bias, through low science literacy, through intersecting stigmas and all kinds of phobias before it got to people living with HIV, before it got to the people and the field it was intended to benefit. So it was filtered out. And there were many ASOs and CBOs that we spoke to in public health bodies that they just didn't know about the science. Many didn't feel comfortable with it, or they didn't have the authority or experience to make public statements about it. We also, and this was the tough part, we spoke with well-meaning healthcare providers who would share U equals U through intersecting stigma and bias only with patients whom they felt were responsible. So people like me, presumably a stable white cis male, I learned in 2012 that I couldn't transmit HIV from my doctor. But communities of color and marginalized folks who are already being neglected by the healthcare system were and still are being left out. So the crazy thing of this all is that there truly wasn't anyone holding HIV information providers accountable for how the risk from a person living with HIV was being described to the world. So we took control of the narrative, and we became the guardian of this very important game-changing message. Next slide. So how did we get to U equals U? And who's we? Please click. So this campaign was driven by people living with HIV from the inception, and many, or most really, from the networks of PWN and Rise Up to HIV. So a hat tip to both groups and everybody involved who made this happen. So our first step was get a global consensus. Get a global consensus on all the clinical and empirical evidence, and then use that statement as evidence and leverage to secure endorsements from influencers in the U.S. and around the world. Then we would disseminate that message through partnerships, through community partnerships that would distribute that information in culturally competent ways for their specific communities. We didn't create a campaign for every specific community. Our partners take the information and then disseminate it to those communities. Next slide, please. So the consensus statement, I think, we don't have to go into the details, but we worked with the principal investigators from Partner, HBTN 052, Opposites Attract, and author of the SWIFT statement. The main thing is that the conclusion was that the risk was not worth considering. It was insignificant. It was negligible, and it was important that this was only specific to sexual transmission, not breastfeeding or injection drug use, and it was also only for people living with HIV on ART, not elite controllers. Next slide, please. And as you heard in the video, negligible is the same risk category as biting, spitting, throwing bodily fluids. Time. Deb, is that time for me already? I don't think that was for me. Yes, I guess it was for me. So what I'm gonna run through this really quickly. But we needed early adopters, and New York City was the genesis of the campaign with New York City Department of Health, NASDAQ, and Housing Works, and then other anchor organizations like AIDS United, San Francisco AIDS Foundation, and our international groups came on. That's the next slide, please. Okay, next slide. Next slide. Just keep clicking through, please. Next slide. Next slide. Next slide. Okay, now we're at 270 organizations from 31 countries and 11 languages, and it grows every day. Next slide. So we'll just quickly go through some of the messaging from around the world. Next slide. The feds were really good to us in the beginning, and still are, with Carl Divenbach, Rich Walitsky, creating videos and audio visuals. Next slide. Terry Chicken Trust is a global leader with their Can't Pass It On campaign, the first in the world to create these materials. Next slide. New York City, Housing Works. We had a dance party in the street celebrating this. Next slide. Housing Works, Live Undetectable, amazing campaign. LiveUndetectable.org. Next slide. Act Up Dublin. Next slide. AIDS in France. Next slide. It's I equals I in Spanish. Next slide. I equals I in Italian and I equals I in Portuguese. Next slide. I equals I in French. Next slide. N equals N in Dutch. Next slide. B equals B in Turkish. Next slide. H equals H in Macedonian. Next slide. You can see people really took this on creatively. Next slide. So the bottom line is the benefits of U equals U are not for some people living with HIV. They're for all people living with HIV. And we have a right to this information about our bodies. And it's not just for us. It's also the best way to end the epidemic. So if you want to help us continue to change the narrative, we'd love people to join. Just go to u=u.org or follow the hashtag U=U to help us change the very definition of what it means to live with HIV and the definition of what it means to prevent HIV. Thanks very much.
Thank you so much, Bruce. Thank you so much. Next, we have Gina Brown, who is the community organizer for the Southern AIDS Coalition and also a very good friend of mine. Gina has worked in the field of HIV for 14 years now and has been living with HIV for 22 years. She graduated magna cum laude from Southern University at New Orleans with a bachelor in social work and a minor in history in 2011. She received her master's degree in social work in 2012. Gina is a former member of the Presidential Advisory Council on HIV and AIDS, also known as PACHA, and has served on numerous boards and committees. Gina?
Hello. Hey, how y'all doing? So I'm going to talk about U=U from a personal standpoint. For me, when I first heard about it, I wasn't one of those people that jumped on right away. I did a little research, and then I met Bruce. And Bruce is so passionate about it, I really wanted to know more. So I joined the Facebook page and started getting involved. And once I really found out what U=U means, I was really, really happy because I don't know for me living as a woman with HIV, I wanted to feel normal. I wanted to feel normal in dating. You know, I want to date again. I want to go out. I want to meet people. And I've always held myself back because, first of all, everybody knows my HIV status. But it's still difficult to have a conversation with somebody about all of the protections you have to take sometimes. So I just stayed out of the dating scene because of that. So once I found out about U=U, like I said, I felt very normal. But then I started thinking about people in my community, people who were struggling with staying on the medications or people who didn't have access to medications. Because Louisiana is a big, not huge state, but we have a lot of rural areas. And there are people living with HIV in those rural areas. So I want to give the information and I want to be that cheerleader and go out and talk about it to everybody. But I think before I can do that in the rural areas, I have to make sure that access is granted to the people who live there. So that's one of the things that that's very important that I do in this work. But here in New Orleans, I've been talking to women about U=U and doing it in a way not so much that, you know, of course, if you're undetectable, you're untransmittable. We know that. I am a firm believer in that. But also in the way of staying healthy. You know, there are a lot of women who are childbearing age, and they want to have children, and they can't afford sperm washing. You know, they cannot afford that. So when you talk about U=U, it also plays into your reproductive health. I think about who's accountable. Our providers are accountable, but you know what? If they don't know about it, how can they tell us about it? So that's another place that we can make sure that we're talking to providers, we're talking to the people who are frontline workers, you know, getting case managers to buy into it and to this science, because it's science. You know, this is a biomedical tool that we have to truly make an impact on HIV. Like I said, I've been living with this 23 years, and for the first time, I have that hope. I have real hope that we can get down to so few infections or transmissions a year that we can see the outcomes of that. You know, I'm not going to talk long because, like Bruce said, he could go on and on. I can go on and on ever since I found out about this because I think it's one of those tools that everybody should know about. We should all be aware of it. We should all have access to it. And now we have to make that happen. Thank you.
Thank you so much, Gina. And I put in the comment how absolutely fierce that photo is. so I just wanted you to know that. Up next, we have Nana Khanna, another one of my personal heroes. She is the Executive Director of Positive Women's Network USA. She currently serves on the Board of Directors for AIDS United, the National Steering Committee for the U.S. People Living with HIV Caucus, as a member of the Women's HIV Research Initiative, and served on President Obama's Advisory Council on HIV and AIDS from 2010 to 2014. Prior to working in HIV, Nana co-founded and served as National Field Director for the League of Pissed Off Voters, love the name, a progressive national organization working to expand participation of young people and communities of color in electoral politics. She is currently pursuing a PhD in medical sociology at the University of California, San Francisco. Everyone, Nana Khanna.
Thanks so much, Tiami, and everyone. Can you hear me okay?
Yes.
Okay, great, perfect. So thanks so much, everyone, for these great presentations. I come to this work as a woman of color living with HIV, diagnosed in 2002 at the age of 25, when one of my major concerns was my sexual and reproductive future. And so it was great to hear Tiami say that when she was diagnosed, she knew she wasn't a danger to anyone. I had a science degree and came from a middle-class background, but I didn't know that when I was diagnosed. And I remember actually feeling infectious, being worried about sharing towels. These might not have been real fears based on science of transmission or anything I was reading or able to find, but HIV has never just been about science. It has always been about stigma, about prejudice, about communities that disproportionately suffer from oppression and marginalization. And so today I'm here in that capacity and with this life experience, as well as in the capacity of Executive Director of Positive Women's Network USA, which is a national membership body of women and folks of trans experience living with HIV. We have 3,000 members across the country. We also have chapters across the country and work extensively in PLHIV community spaces and in decriminalization spaces. And so my comments are going to focus sort of at that intersection. The majority of our members are women of color and low-income folks, which definitely reflects the U.S. epidemic among women. And this issue is deeply important to us because treatment as prevention information is a fundamental human rights issue for myself and for the communities I work with and represent. For people living with HIV, treatment as prevention really has the opportunity to expand our human rights, our dignity, and to fundamentally shift the quality of our life, in part through our sexual and reproductive rights, the expansion of our sexual and reproductive rights. And so I wanted to just quote briefly from Trust Black Women so that folks are grounded in a reproductive justice frame, and that's the perspective we come from at Positive Women's Network. So reproductive justice recognizes that the ability of any person to determine their own reproductive destiny is directly linked to the conditions in their community. And these conditions are not just about individual choice and access. So for example, a woman cannot make an individual decision about her body if she is part of a community whose human rights as a group are consistently violated. For example, through insufficient quality health care. So reproductive justice is a lens that addresses issues ranging from population control to bodily autonomy and self-determination, immigrant rights, and criminal injustices that limit individual human rights because of group or community experiences. So in March this year, for National Women and Girls HIV/AIDS Awareness Day, PWN USA released a bodily autonomy framework, sort of linking these ideas and intersections. And this is available on our website, pwn-usa.org. Bodily autonomy is the simple but radical concept that individuals have the right to control what does and does not happen to our bodies. So when we have full bodily autonomy, not only are we empowered to make decisions about our health and our future without coercion or control by others, we also have the support and resources needed to meaningfully carry out those decisions. And so that includes information from our providers. So for example, the science on treatment as prevention means that we can conceive naturally, which, by the way, women and people of trans experience living with HIV have been doing already for decades, sometimes by choice and sometimes not by choice. There can be substantial gendered power dynamics around condom use and contraceptive use. Also, for women and for all people living with HIV, reproduction is not our only concern as it relates to treatment as prevention or the idea that undetectable equals untransmittable. Like everyone else, we want to enjoy sex without worry, without concerns about transmitting anything to anyone, and without condemnation or censure from our healthcare providers and those who are providing services to us. Something we don't talk about a lot in the U.S. is the right to sexual and erotic pleasure, and that is a right that people living with HIV have. So despite all this conclusive evidence that was presented to us earlier by Dimitri, by Bruce, that treatment as prevention works, information is not consistently getting to women living with HIV from our providers. PWN USA conducted a survey of about 200 women living with HIV in 2013, a couple of years after the HPTN 052 data became available. We found that for women living with HIV engaged in care, 60% had never been told by a provider that if they were virally suppressed, they were less likely to transmit HIV. We asked that same question in another survey conducted in 2015 and found that still over half of women living with HIV engaged in care had not been told this information. So the right to information about our own health and our own ability to manage our HIV and to prevent transmission to others is a human right, and we perceive this lack of information as a fundamental human rights violation. I think it's also critically important to highlight that women living with HIV in the U.S. come from communities that are already disproportionately and historically impacted by reproductive justice violations. We are mostly women of color. We are mostly low income. And separately from HIV diagnosis, there is a long history of reproductive rights violations of women of color in this country. In fact, there is substantial data on forcible sterilization, coercive tubal ligations of Black women independently of HIV diagnosis, and stigma from providers about sexual and reproductive rights for women of color and low-income women intersect with other forms of stigma, such as HIV stigma, to create a constellation of effects. We also see that the lack of public understanding of how HIV is transmitted presents direct danger to people living with HIV, especially women. So we have stories, hundreds of stories, but a couple of high-profile stories have been the cases of Cicely Bolden in Texas, a young woman living with HIV who was brutally murdered after disclosing her HIV status to her partner because he thought that just by having sex with her, he had automatically acquired HIV. And so the headlines that were running was basically, she killed me, so I killed her. A similar story out of Texas just a couple of years later was a young woman named Alicia Henson. And so the lack of information about the ways in which people living with HIV do not present a general danger to society, including through our sexual lives and sexual practices, is actually deadly to us. It has deadly consequences. We also know that over 30 states in the U.S. currently have laws criminalizing people living with HIV, and in many cases, prosecutions are occurring where no transmission happened or was even possible. So people living with HIV can be prosecuted for alleged exposure and alleged non-disclosure. PWN USA believes that having a suppressed viral load should absolutely never be a requirement to avoid criminal prosecution. However, it is important that laws are updated to reflect that there are many ways people living with HIV can demonstrate they are taking steps to avoid exposing someone and avoid transmitting the virus. So treatment as prevention and the U equals U message have tremendous implications for our lives, our health, our safety, and our dignity. And I urge the community, our providers, and certainly our federal agency partners to take this information really seriously and think about how the human rights and safety of people living with HIV can be protected and upheld. Thank you.
Thank you so much, Nana. And next, it is my esteemed privilege to acknowledge Noel Gordon, who works at the Human Rights Campaign. Noel currently leads efforts to combat the dual epidemics of HIV and HIV-related stigma. And as the organization's first ever senior program specialist for HIV prevention and health equity, Noelle has helped HRC educate thousands more people than ever before about the current realities of HIV prevention, treatment, and care. He has also helped position HRC as the leader in the fight for unfettered access to pre-exposure prophylaxis, comprehensive sex education, and other common sense policy solutions. And once Noelle is done, I will be back for a brief moment before Dayton introduces our next speaker. Go ahead, Noelle.
Great. Can you all hear me okay?
Yes, love.
Perfect. Well, first and foremost, let me say thank you to the organizers of this webinar, and also special thank you to Bruce and the U equals U community for getting us to this point. Given our role as the nation's largest LGBTQ civil rights organization, HRC is committed to working with our friends, allies, members, and supporters, many of whom are on this call, to end the dual epidemics of HIV and HIV-related stigma. And we agree with the Prevention Access Campaign that all people, including those living with and affected by HIV, have a right to accurate information about their bodies, which is why we are so grateful to be included on this webinar and to share our support for the U equals U messaging and to anticipate with great expectation the actions the federal government will take to ensure that their communications are similarly accurate and correct. HRC works each and every day to educate LGBTQ people and allies about the current realities of HIV, and for us, those efforts must include the fact that people living with HIV who are durably virally suppressed do not transmit the virus to their sexual partners. We've been proud to work with the Prevention Access Campaign to disseminate U equals U messaging to our members and supporters nationwide, to create resources that reflect the information provided to people living with and affected by HIV, to ensure that those communications are ethical and scientifically grounded. And finally, we're proud to work with the Prevention Access Campaign to help improve the coverage of people living with and affected by HIV through the Accuracy Watchdog, a joint initiative between the HRC and the Prevention Access Campaign to ensure that coverage of this issue is accurate, correct, and ethical, and free of stigma by contacting reporters, bloggers, and several other media outlets, and making sure they have the resources and the support to lead with this message and lead with it correctly. And so from a professional perspective, I can say with honesty and integrity that the U equals U effort has improved HRC's LGBTQ and HIV-related advocacy, and beyond that, it has pushed us to ensure that our communications set the standard for how other LGBTQ organizations talk about this very important issue. From a personal perspective, I'm very thankful to the U equals U community and Bruce in particular. I'm an HIV-negative man, but my commitment to this issue stemmed from, quite frankly, the lack of attention I saw being given to U equals U at a time where so many were celebrating and welcoming and embracing pre-exposure prophylaxis. I get great, and I feel great joy, but also self-empowerment from being able to take pre-exposure prophylaxis. And I think it's wrong for people living with HIV to be denied access to those same feelings of self-empowerment by not knowing about U equals U and the power of this campaign. And so with that, I want to reiterate my thanks, my gratitude for the organizers and for the federal government for looking into this issue. And with that, we look forward to seeing where this campaign goes. Thank you.
Thank you so much, Noelle. And again, this is Tiami. And just to speak a little bit about the personal impact, I want to say that, you know, in that time frame from September to actually April, September 2012 to April of 2013, I took myself off the market as well because I was afraid that I was going to transmit the virus. I didn't have I actually took responsibility for my actions. There were times when I did have condomless sex, and as a result, I contracted HIV, right? So at that point, I just wanted to get better. I was sober at the time, had been sober for 2 years at my diagnosis, and I wanted to live. There was a time when I didn't want to live, and I did things that were not beneficial to my health, right? So I accepted my responsibility, and in my diagnosis. And so they gave me further responsibilities to actually find treatment, get into treatment, stay into care. And like I said in the beginning, once I understood what undetectable meant, as I worked in the field, it became a thing of me talking about being undetectable versus hearing virally suppressed, right? And so I have always leaned towards undetectable. And that's just the impact that it had on me. And when this news broke out, where I first heard about it last year, right, I was overwhelmed. I was ecstatic. I jumped on board, but I also had to think about the people who cannot achieve viral suppression or that undetectable status. In celebrating that I'm not a danger to anyone. I didn't want anyone to feel isolated, right? And so I have been actually working within my community, the trans community, for one, because we do have a harder time getting to being undetectable, right? Because we have so many social determinants of health that prevent us from even accessing the doctor. And so that's why it has been a personal mission of mine to spread this message as far as I can, far and wide, and to actually work within my community to see what it is that can be done to help my community get to that undetectable status. So I just wanted to reiterate that in celebrating our success, let's be mindful of those who still consider themselves to be a danger to someone else and their mindset. Devon, thank you.
Wow, Tiami, thank you so very much. And I'm going to try and be as brave as my brother, Jesse Mylan,